they could do both, right? If they want to speak, their device. Phone. All right. Well, with that said, good morning, everyone. We're calling the meeting of the Washoe County Regional Animal Services Advisory Board to order. I welcome everyone who's made time to join us in person and on Zoom. We are a little short on quorum. We have a quorum, but we're a little short on team here due to some medical challenges this morning. But what I'd like to do is ask Madam Clerk if you could call the roll, please.
Naomi Dewar, Chair.
Here.
Paul Anderson, Vice Chair. We'll be running late. Mayor Luz Garcia.
Here.
Trudy Broussard. Present. Julie McMahon.
Present.
Jill Fisher will be absent today. And Diaz Dixon looks like he is also absent.
Did we hear from him or no? Okay. Commissioner Garcia, could you lead us in the pledge? Thank you.
Please join me in a salute to the flag. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. We're moving on to item 3, which is instructions for providing public comment via Zoom or phone. Madam Clerk.
There we go. This meeting is held in the Commission chambers and via Zoom webinar. To attend the meeting via Zoom webinar, please log into the Zoom webinar at the link that's found on page 1 of the meeting agenda. You can also join the meeting by typing zoom.us into your computer browser, clicking Join a Meeting on the Zoom website, and entering webinar ID 958-7343-8280. Alternatively, you can join us today by phone only by dialing 1-669-900-6833 and enter webinar ID 958-7343-8280 and press pound. For those of you wishing to provide public comment today, you can do so either by attending here in person. You can also provide public comment via Zoom. During any public comment period, you can utilize the raise hand feature. And to provide public comment via telephone only, please press star 9 to raise your hand and star 6 to mute or unmute. Thank you.
All right. Thank you to our DA. And I just wanted to note for the record that member Diaz Dixon has joined us, so if you can mark him present. And now we're going to move into public comment. Madam Clerk, is there any public comment? She's saying no. Have you checked online as well? Okay, either in the room or online.
There's currently no one available for public comment.
Okay, we'll close out public comment, and then I'm looking for a motion under item 5 to approve the January 26, 2024 meeting minutes. I'm looking for a motion.
So moved, Madam Chair.
Okay, we have a motion, a second.
Julie McMahon for the record. I'll second.
All right, so we have a motion from Member Garcia, second from Member Julie.
McMahon.
McCann, thank you.
McMahon, like Ed McMahon.
Yeah, I know, McMahon. I know, it just, sometimes you get a blank.
Yes, no.
Anyway, all in favor, please say aye. Aye. Any opposed? All right, hearing none, motion passes unanimously. The next item up is a report on the Community Cats Program presentation. I specifically asked for this. I want to invite Tracy Dean up to the podium. This has been an issue in our community periodically and recently quite a bit, I think due to the challenges with our trap, neuter, and release program. So would you like to join us at the podium? And then just introduce yourself for the record. And I don't know, do you have a PowerPoint or just going to talk? Or got it up. Okay.
Does a little red light come on? It is on? Okay.
And you can lower that mic a little to you. There you go.
Okay. Hello, good morning, everyone. My name is Tracy Dean, and I am the Director of Community Cats. a local 501c3 group formed in 1999. Therefore, we are 25 years old this year. Everybody hear me okay?
Perfect.
It is an honor to stand in this chamber today, and we appreciate the invitation to make a presentation. And we recognize the commitment of everyone on this board. Back in time when the city ran our facility, I was on that advisory board at that time. On behalf of Community Cats, I'm grateful for the support from the city of Reno, who has deemed our grassroots nonprofit as a cause to financially support. We also were honored with the proclamation of Global Cat Day on October 16th, which will be coming up again this year. In Washoe County Regional Animal Services, we have found a partner and established ourselves as a resource to serve our community. The funding we receive goes directly into spay-neuter services and promoting trap, neuter, and return. TNR is the globally recognized method of managing free-roaming cat populations and is the first choice for free-roaming cats in Washoe County. We are an all-volunteer organization. When I took over what is now the 25-year-old organization 2 years ago, I did not know what Community Cats could really accomplish. We knew we wanted to partner with other groups to educate the public about TNR and demystify the process. And we wanted our residents that wanted to do the right thing to be able to get the help they need and to understand what TNR is and empower them to take action. We receive referrals from and have partnered with the SPCA of Northern Nevada, Options Veterinary Care, and Feral at Heart. With the Nevada Humane Society, we appreciate their financial support by waiving the fees in their clinic. Community Cat stands ready to be boots on the ground, and we fill a gap in services not available, usually due to staffing shortages at this time. How can we do better in the short term? Perhaps we can create a TNR working group to address the needs of Washoe County, made up from people of the main organizations that are involved. Maybe a coordinator of this working group is paid jointly by each agency. We believe that the data of the entire county needs to be the focus, not just what each one group collects on their own. That will give us the needs of our community that we don't currently have available to us. For the longer term, gather information and data for the future programs, establish collaborative relationships, develop strategic goals and timelines, and secure funding to implement the plan. Now I'm going to refer to the first page of our handout that you guys all have and what's up on the board. It's basically our mission statement and our short and sweet goals of reducing suffering, removing obstacles, and saving lives. And our mission statement, everybody, is it pretty clear? Okay. In your bound copies of the handout, these are the tabs and refer to what subjects they're talking about, couple of photos from our community. We are a totally local group. You'll never see a stock photo. These are cats and sometimes dogs and people in our own neighborhoods that we're dealing with every day. In 2023, up there are the highlights of our numbers and of data that we did collect. 489 cats were assisted in getting into the TNR clinics, up from the year before previously, of course, and then 63 kittens or friendly cats were dealt with. Other agencies got involved at that point because we do not do adoptions. I'll say that we did 3 last year. It was way too much for me. And talks about the proclamation from the city of Reno on October 16th. I do hope that this year we can plan ahead and have something going on to focus our attention on cats. we partnered with a lot of groups and did a lot of different things like netting cats in houses. That's always fun if anybody ever wants to go to that kind of event, rodeo, we'll say. We did help the vets in Dayton put on a TNR clinic themselves. That's their own idea. And we, as Community Cats, do partner with them and donate to them to make that happen. And they did 70 cats in one day. And that's a focus on the rural community cats. And then we did do our, kicked off our Ward 1 TNR project with the pop-up pet food pantry. The photo you see there, that's the cat on the left has been placed up for adoption with the SPCA. That's Gibby. He may be adopted. And the one on the right is still there. These are cats that are under the pedestrian walkway over Glendale Avenue at the Indian Colony Street. So not a good place to be, but that's where they are, and they are fixed, and they're waiting to be trying to find a different location to live. We worked with Humane Network in coming up with some purposes and goals regarding coalition building and partnerships. That is pretty much basic spelled out there. And this will be the last PowerPoint page. What we're doing is we're introducing something that maybe some people have heard of, but it's a large-scale, long-term, 5 to 10-year project that may be the right fit for our community. And that's what I'm just putting out there in the universe for us today. It's an approach to TNR versus what we're doing currently. Right now, we are running out to put out fires. We're talking to people. We're helping our individual people in our community, sometimes a whole neighborhood. Might be a trailer park, apartment complex, a street. And that's great, but to make a real long-term difference, we have to think bigger, and we have to plan more, and we have to collect data. And so that's gonna take a big effort, a lot of people involved, funding involved. As I stated earlier in the purposes and goals, we're just really needing to step up our game if we really want to make a difference for our entire community and not just individual areas. And in closing, with the continued support from the groups I mentioned previously, we hope to get our TNR goals back on track to help more cats and more people in our community. I thank you very much for your time.
Tracy, excellent presentation. Thank you so much. And this book pamphlet is very helpful. You know, we really appreciate that. A lot of work went into it, obviously.
Yes.
Let me ask, are there any questions from the advisory board for Tracy? Yeah, Julie. Yeah.
Okay. You, in your very closing statement, you had stated.
I'm sorry, I cannot hear you.
Is that better?
Yes.
Okay. In your closing statement, you had said that you want to get the project back to where it used to be. Can you elaborate on that for just a little?
I don't have numbers for this. I wasn't collecting data at that time. I was just a volunteer trapper that I still do now for 25 years. But just as I just gauge the community and the areas I'm in, I think our highest point probably of TNR was probably about 2014, 2016. And I think just in my world, in my just anecdotal seeing what's happening, I think we've slipped down since then. And it's just been ongoing slow. I was really surprised that people did not know that there was a clinic for TNR each week at Nevada Humane Society. The only time for any length of time there has not been a clinic each week in our community. It always wasn't Nevada Humane Society per se, it was / Community Cats at that time, is 4 months in 2020. Besides just veterinarian being on vacation or being at a conference or something, it's still going on every week because I'm there, and surprisingly people don't know that. In August 3 years ago, Options started offering their community the TNR clinic services that they currently offer also. So that's just unknown now, and it's just been a lack of promoting, a lack of organization that let people know what was happening. And it was surprising to me that some leaders in our community did not know that that was still currently happening. And so that's very appreciative. We need to keep that up. We need to let people know. And that's the biggest thing that I'm doing is we just received we have a phone that's just for community cats calls, not my own cell phone anymore. And that number is on the new Washoe County page that I'm sure Cheyenne will talk about. So that's great. But yeah, I would say that was, we've been downhill. And then 2020, COVID hit everybody, and that really affected the services and the knowing about the services.
JC, if I could just get some clarity. Today, there's a clinic at Nevada Humane and a clinic at Options every week.
Yes.
Okay, perfect.
Yeah.
Do you know how many cats they're able to treat in each of these clinics on that day?
I know that in 2023, Options did 1,771 cats through their TNR clinic
In the year?
in the year of 2023.
Do you have figures, or maybe Jerlene can provide those when she comes up later?
I don't have it broken out for just TNR. I don't have that
Okay.
number.
All right. And then I have a question, but I want to continue. Are any other board members like to ask a question? Mr. Dixon?
Dias Dixon for the record. How you doing?
Good, how are you?
I'm doing good. One suggestion I would make for you is to consider talking to the University of Nevada Small Business Development Office, because they can help you develop a really good strategic plan, and it won't cost you anything.
Cool.
So
I like that. I will do that.
Okay, great suggestion. Ms. Garcia, anything? Okay, and yes, go ahead.
Trudy Broussard for the record, am I on? Can you hear me?
Yes.
I was just curious, I know that any volunteer organization has difficulties with finances and volunteers, and you mentioned that the lack of public awareness. What other obstacles does the public present to you? Do you get pushback from people who don't want this to happen, or who?
Oh, sure.
What-
Sure, there's a lot of people that don't believe that TNR is the answer, and they are going to resist that. That's common. That's not unique to our community at all. That's a pretty common thing. And in 2006, maybe closer to 2008 or so, this community decided it did not want to spend taxpayer money killing cats because they were feral. And some very good people at the time took the heat for that, but that's been pretty much our county's philosophy is trap, neuter, return. And I think that was very important when that new facility was built. That came soon after that. So we just have to work with people and mitigate issues. Most of the people I talk to, and I did the help desk for many years, so people calling in with various questions and issues, most people are open to trap, neuter, return. They just want something to happen to improve the situation. A lot of people are looking, that's why they're calling in, they're looking for help. They're not looking, if they wanted to do nefarious things, they would do that. So they're looking for help, and I think when you can explain what is available and how we can work together and help mitigate nuisance issues that might come up, more people are open to that. So that's what the goal is.
So when they object, they want to euthanize all the cats instead of neutering and releasing?
Some people think that's an answer. I do want to bring up a terminology question or issue. Euthanizing is for suffering animals. This would not be euthanizing. These are, if they're a healthy cat, they're a healthy cat. So they would just be killing a cat because it's feral. And I don't disagree with euthanizing, of course, a cat that doesn't have a good prognosis in life. That's different. But we're talking healthy cats that live in neighborhoods. And it's a very fine line to decide sometime if they're somebody's pet or not somebody's pet. And that issue comes up quite a deal when you're making it a routine situation where you're rounding up and killing cats. Eventually, there's going to be an issue with somebody's cat got caught up in that net because they roam, because that's what cats are allowed to do. And that's what we are talking about, free roaming cats. So sometimes they are people's pets, sometimes they are former pets, sometimes they are strays, sometimes they are feral.
I see. And I think I've read in all these statistics that very few cats are microchipped, but I assume you check for that.
Yes, every cat, usually the standard procedure coming into the clinic, as soon as they are safely knocked out, they are scanned for a chip. Yep. And there have been pets reunited with their owners through that process too.
All right, thank
Yeah.
you very much.
You know, an observation I have is that this is the same challenge is something that we're facing in other animal populations as well, where there's a population that may be feral, may be, have been released, let go in the wild, may have been born in the wild, and the concern about overpopulation, a concern about killing, versus essentially what you're doing, sterilizing, is similar to, for example, what they're doing with horses. You know, they're attempting
That's
to
right.
sterilize them rather than kill them.
Right.
And so I can see some analogs here, so I really appreciate that. My final question is just, what can we do, either as an advisory board or as the agency, to assist or support you?
Well, this forum is first off great, and I really do appreciate that because we are a small group. We are very grassroots. You can't get more grassroots than us, I don't believe. So we don't have a lot of platform. We don't have a big voice. Groups like yourselves and the organizations in our area that have bigger voices, we appreciate them bringing this issue because it is kind of easy to ignore a lot of the times. A lot more pressing things going on in our world and in even our animal community. So, and the cats roaming around don't make a big, they're usually just skulking around and we don't always see them. So they're not being present, counted for readily. They depend on people to show up to help them. So I think, and that's part of it, the public campaign and educating people.
All right. Well, be sure to let us know if something comes up. That's why I asked for you to be on the agenda. That's why I asked for you to be
I do
first.
appreciate that greatly.
Because I really did want to put a spotlight on the work that your group has been doing for 25 years.
25 years.
And what an important resource you are for our community and especially the world we're in. I mean, we're focused on animal welfare essentially, and these are dear animals as well. So
Great.
thank you for your service.
Thank you, and we are available if anybody wants to learn about TNR, anybody wants to have some kind of an education meeting about TNR, I think that would be really helpful for the
Okay,
community.
good. And I hope you come out to groups like, for example, this summer there'll be Art Paws, which is a place where animals and art come together. But I know they often have booths. Have you been at those booths before?
I have previously, not since Community Cats. I know that we intend on being at Fiesta on Wells.
Yeah.
I think that's a really important event for us to be at.
Well, I would also suggest this one in July. It's hugely attended, lots and lots of animal lovers, and if you want to get the word out, it might be a good place.
Great, thank you very
Okay.
much.
And I know our own agency started going and saw some benefits, both in awareness of what they do, adoptions, and so on and so forth. So it's just one more place.
Great.
Okay, let's see, we're going to close out item, let me ask, though, I know this is not an action item, but does anyone want to make public comment on this? Okay, we'll move on. We're moving on to the director's report, item 7. We're going to hear all of the good things that have been happening over the last quarter. And also, if there's challenges, of course, Cheyenne. Need to share those too.
Only good things.
Okay.
Good morning, everyone. Cheyenne Shull for the record. It's my pleasure to be here to provide Q3 statistics and updates for all of you in our fiscal year 24. So with regards to that, if my slideshow can be prompted, there it is. We're looking at our impounded animals that came in the third quarter, quarter over quarter, the last 5 fiscal years. So you'll note from the bottom up, we have The light blue are cats at the bottom, so 764 cats came in last quarter, and the next number is dogs in the dark blue, with 1,392 of those. And the top number there in orange are miscellaneous small animals, and so you'll see that there's a trend downward in dogs and cats. A 6% decrease in dogs and 11% in cats, which we're all celebrating. It's an awesome decrease. But we saw an increase in the number of small animals. I'm not really sure what the correlation is to that, other than a lot of times when there are evictions, animals that get left behind are the guinea pigs, the rabbits, the lizards, the snakes, all of those miscellaneous animals. So a pretty significant jump there of 55% in those miscellaneous animals last quarter. Of course, the largest makeup of the animals impounded are lost and stray animals. 1,439 of the total number of animals that we took into that quarter were lost and stray. 358 of those were deceased upon impound, and then 260 of those were confiscates. So that's just a general makeup of the 2,378 animals that we took in last quarter. I apologize, this slide title is incorrect. It should be length of stay. But the top two green slides indicate dogs and cat intakes for last quarter. And then the bottom two slides reflect the length of stay for each species, quarter over quarter for the last 5 fiscal years. So as you can see, the length of stay has decreased slightly for dogs by approximately a day, which we will celebrate every hour of that 24-hour period. And the length of stay for cats is still right about at 6 days. All animal outcomes, essentially how animals left us, whether they were transferred, euthanized, reunited with their owner, or other. This chart is depicting the second column from the left is fiscal 2024, and the third column is 2023. So you'll see a slight increase in the animals euthanized. We jumped from 69 to 82. Other animals can encompass animals that were relocated, animals that were taken home by staff. For example, we had a couple of fish that one of our staff members took home that were abandoned. So that can incorporate a lot of different outcomes. Reunited, we jumped a little bit, 12.5% of animals that got reunited last quarter with their owners. And animals that were transferred were down by approximately 24%. And vet euthanasia. Remember, there were some questions about this last meeting. What does vet euthanasia mean? So you have to keep in mind that Good Samaritans transport animals to our veterinary clinics around our region often, and they are injured or sick. And so oftentimes those animals will, for their quality of life, be euthanized. But we did see a decrease in that from 23 last year to 18 this last quarter. This next slide depicts the animals transferred, with the most recent quarter being listed first in our donut pie chart there, if anyone's hungry. With the largest majority of the animals, of course, going to our partners at Nevada Humane Society, just almost 84% of those animals being transferred. The SPCA took 48 animals from Animal Services. Options Veterinary Care took 11 cats from us. Pet Network received 3 animals, and Rescue received 37 animals, with 73 animals going to other rescue partners. Last meeting, this board had questions with requests for a further breakdown of euthanasia and the reasons for euthanasia, and so I'm going to attempt to spell that out a little deeper today, but also to remind you all that if you do have social media and you are following our Facebook page, every Thursday, we call it our report card, is published with statistics of how animals came in and how animals went out, and euthanasia is also spelled out in that report card. So if anyone is interested in following that on a weekly basis, we do list that, and we are very transparent about the reasons why those animals were euthanized. I want to talk about the categories of why animals are euthanized and what they mean, because you'll see medical severe, behavior, ADL, and so some of those disposition categories and what they mean. Medical means, of course, an animal is suffering or quality of life issues are coming into play, and so the animal has been determined to be suffering, and so quality of life decisions are made and the animal is euthanized as a result. ADL is the disease laboratory. So when an animal needs to be tested for rabies, they are oftentimes euthanized. Well, every time they are euthanized to be tested for rabies. And so when we outcome an animal with ADL, that's what it means, is that we're sending it to the laboratory for testing. Animal aggression towards other animals, I think, is pretty self-explanatory. If we have animals that are not getting along with other animals and are wanting to attack other animals, that's generally going to be a reason for euthanasia. And then behavior encompasses a wide array of reasons. There could be behavior that an animal is not socialized, or we have behavior sometimes that an animal is so stressed that they're self-mutilating in a shelter environment. And for, again, quality of life reasons, those animals are euthanized. And then the no interest category is probably the one with the biggest controversy around it that we talked about late last year in regards to capacity and challenges related to animals not moving through our shelter system rapidly. When we reach out to all of our rescue partners and there just simply isn't an interest in an animal, but we have not found anything wrong with the animal, no interest is an outcome that sometimes occurs, although we try every avenue not to have to make that euthanasia decision. So hopefully that spells out a little more detail related to euthanasia reasons. We euthanized 27 cats last quarter and 48 dogs total, so we were down by 1 dog last quarter and up slightly in cats. So this is a little bit more of a breakdown related to euthanasia. Animal reunifications in the field. This chart represents all the lost and stray animals that were picked up in the field and their reunification success. So starting from the bottom, the light blue are animals that were picked up and returned by field officers. So 41% of the animals that my field officers picked up were returned in the field out of a total of 651 animals that were picked up out of the field. The next slide will depict animals that came in to the shelter and were reunified from the shelter. So again, starting from the bottom, the lighter blue are the animals that were impounded and returned from the shelter. So 36% of animals that came into the shelter were returned out of 771 total animals that came in over the counter. Moving on to field service calls and types. So you'll see that what is interesting about this slide is that we are relatively similar every quarter, year over year, for the last 5 years on the types of calls that Animal Services receives, despite the fact that our community has grown and we have a lot more pets, presumably, in our community. So from the bottom up, the dark blue or the lighter blue is bite investigations. So we had 257 bite investigations last quarter. And the next darker blue up is noise complaints. We had 411 noise complaints. And the gray is other. So that encompasses a whole host of types of calls or complaints that get lumped into that category. So we received just over 1,000 of those. And then, of course, the lion's share of our calls are the stray or lost animal calls. We received just over 2,000 of those. And the next pinkish orange color up there, 291 unrestrained animals, so people that are potentially with their animals but they're not on leash. And then the last top number there is welfare cases. And so again, what I would like to highlight about this particular slide and the metrics that we're seeing here is we're seeing a consistent downward trend in those welfare cases and calls, which is a tremendous
Phenomenal
success.
news,
Yes.
right,
Yeah.
phenomenal news. It's fantastic.
So this is just the outcomes of those welfare calls and what the outcome was of each of the calls that my officers responded to. So 87 of them were unfounded calls. The bulk of them, 210, were other outcomes, meaning that the call or the complaint was resolved majority of the time, which is what we want to see. For when it's appropriate, we want to see pets kept in the homes. We want to see owners educated and the resources and tools made available to the owner to responsibly keep their pets. And then lastly, the cite or notice of civil penalty is that punitive approach for those individuals who are just not compliant or the crime was just too egregious to be able to resolve. We had 54 of those for a total of 351. Outreach continues to be a super busy division area in animal services. We did 8 events last quarter. We had 85 care support referrals that came through animal services. We helped 234 seniors with pet food at our pet food distribution for a total of 417 pets owned by those seniors. And we administered 1,765 vaccinations through our clinics. So that was actually our slow time of year, so. We're bracing for the busy time of year where we actually go out into the community with more vaccination clinics, and we do a lot more things when the weather's nicer. Care support, this is just a comparison of this quarter over last year. We were down a little bit in some of those referrals, and I think I talked a little bit about this last meeting. We shored up our process for reviewing some of those CARES referrals because it was simply growing legs and getting out of control. We were not able to keep up with the referral process, and so we had to tighten up some of the criteria for that, and so that has likely led to some of the decrease. The pet food to seniors, we had a slight decrease in that. I'm not really sure. 234 versus last year we had 275 because every pet food distribution day that I go to, the line is around the block. But I did hear some anecdotal information from someone that they had spoken to several seniors that they're just now starting to come out of their homes to participate past the pandemic. And so that could be some correlation to why we saw a little bit of a downtick in that participation. And then pet food, we were down a little bit for pets served. And then again, vaccinations given. This is definitely an important statistic to celebrate. The increase, the number of vaccinations given is up 1,765 from only 358 last year. So that's a significant jump. And then the pets vaccinated also, up 753 animals from 197. So the more pets we can get vaccinated, the safer our community is, and hopefully the less issues we have with communicable diseases amongst our animal population.
And Cheyenne, just a quick question on this. The vaccines given, are they being given by animal services or are they outsourced to someone else?
The vaccinations, the statistic that is listed here are vaccinations given by my staff.
Okay.
Yes, so you might have one dog or one cat that receives 3 vaccinations or 2 vaccinations from us, and so that's where that discrepancy between pets vaccinated and the number of vaccines given comes from.
Oh.
So here's just a little bit more of a breakdown, 5 clinics for vaccinations and microchips. We also instituted our free senior vaccination clinic this year for the first time since 2020, and our senior population had been asking for it and desperately waiting for us to provide this clinic and this resource for them that had desperately been waiting for. And so we hope to be able to offer these more frequently now, and we hope that our seniors will be able to participate. We need to find a new location. We did this at the Livestock Event Center, but it wasn't the most appropriate venue for seniors, and so we need to find a better location indoors that is safe for the seniors to participate.
And just a quick question, I mean, these are not included in your previous vaccination numbers, these are separate?
This is included, yeah. She just broke it down
Oh, a
further by.
subset
Yes.
of the vaccinations?
Yes.
Like the 753 pets vaccinated, a subset of those was for seniors or all, I'm unclear.
That's total. Pets served out of all the vaccine clinics. So 753 pets, and then 515 rabies vaccinations were administered 478 microchips were implanted throughout these clinics, and then the one free senior clinic with a subset of those total up there.
So the 185 pets served is a subset of the 753 pets?
I believe so.
Okay.
Yes.
And then just a quick question, you said free, so we charge for the others, and is it at a standard rate, a discounted rate? In other words, would it be the same if you went to your vet to get a vaccination versus to you?
Our low-cost vaccination clinics generally are $10 per vaccine. However, we recently received a grant from Petco Love Lost for free parvo, distemper, and FVRCP vaccines for cats. So we have integrated that into some of our vaccination clinics to provide those vaccinations for free. The rabies vaccination and the license is still at charge. And so I think that's where some of the uptick has come from in participation in some of our events, is those free vaccines. But they are still very affordable. I don't know what the going rate is for vaccination fees, but most vet clinics do charge an exam fee in addition to vaccination fees. So you can't just simply walk into a vet hospital and pay the vaccination fee. So you're going to have to pay probably a minimum of $50 for a vaccine. And then the pet distribution events, we did 3 of those, as already highlighted. I wanted to highlight that the last statistic there is 37% of homebound seniors receive some of our benefit of pet food. So the folks that can't participate in Come Down to Senior Services, we do have pet food that we leave at Senior Services to be delivered with the meal program. So that pet food gets delivered to those homebound seniors. This is our social media performance and statistics. We had just over 800 new followers, reaching 143,272 individuals, with 54,200 visits directly to our page. We did 91 posts, and we had 29,000 reactions to our posts. And I wanted to highlight that the posts have been a pretty significant focus of my team. I think last quarter, we also talked about this at our meeting. The number of concerted posts that we're trying to do with content that is meaningful to our community, we're really trying to focus on, and it takes a tremendous amount of time to put those posts together with visuals and things that are meaningful to our community. So we're excited to continue sharing valuable information with our community through our social media avenues. These are just a collective slideshow of photos from some of our vaccine clinics. This one was the North Valley Community Vaccine Clinic. This was the very first one where we implemented the free vaccines as part of the clinic. And I think Quinn learned, she's my program coordinator, that not having an appointment requirement was probably the biggest downfall. She showed up to a couple hundred people in line. Unfortunately, we were not able to provide vaccines for all of these attendees because we ran out of time and the vet had to leave. She actually stayed an hour after she was scheduled to stay. And so we offered those individuals the option to come to our next clinic at the shelter for free vaccines. But this was definitely bit off a little more than we could chew in this clinic. So we're going back to that appointment-based system so we can plan and adequately handle the number of people that show up. And then this is a few photos from our vaccine clinic for the seniors that we did also last quarter, and lots of happy individuals here. One great little story was that after the clinic, I was relayed information about one of the seniors who had been trying to get into some type of housing, and they were needing vaccinations for their pets and having a difficult time getting into a vet, and that this helped them facilitate getting into housing. And so I was happy to hear that.
Wow.
Makes it all worth it, because it's a lot of work to put these vaccine clinics on.
Right.
So next quarter, we have 5 vaccination clinics scheduled. We have 3 pet food distributions, and that pet food distribution happens on the 3rd Tuesday of every month at Senior Services. Microchip clinic, 1 specifically focused on microchips, and then we have 1 scheduled booth at an event for next quarter so far. That could very likely change. And additionally, I would like to add, in relation to updates and things that are not included in my slideshow that will likely be questions that some of you have, Tracy Dean talked a little bit about some of the things that Animal Services has been doing to help unite the efforts that community cats as well as Feral at Heart and other cat groups in our community are trying to do. And we're working with Nevada Humane Society staff to work on that component of education, because I feel like that's the biggest, the most difficult thing and the weakest link to get out to our community is what is trap, neuter, and return? What are community cats? How can you help? And so I shared, I believe, with this board some of our social media graphics that we're trying to get out to the community about what an ear-tip cat means. And then we're going to start staggering some more of those throughout our social media posts. We also created a community cats page on our Washoe County site, as well as a trap, neuter, release page. And I've been working on a flyer for trap, neuter, and return that lists all of our partners in the community so that my staff can hand them out, our community cat partners can hand them out with resources on who offers TNR and where to go for resources so that we can start bringing and tying this information together to make it simpler for our community to help us to participate if they want to participate and ask questions and things of that nature. So I wanted to highlight that is an ongoing effort that we will be continuing to work on. The other thing is that Washoe County Regional Animal Services and Nevada Humane Society have continued to work on our partnership goals and work sessions behind the scenes. And we are going to be hoping to have some measurables to bring to you all at the next meeting in July. We are meeting with our behavior professionals on May 2nd to talk about how do we align our transferability criteria, animals that are deemed dangerous or not transferable for various reasons. That plan and that meeting got pushed out for some medical issues that we couldn't contemplate and plan for, and so we don't have deliverables today. But just know that we are working on things. We are definitely continuing to partner on the things that we talked about, the things that we put into the goals out of those work sessions. However, I feel like it's a bit premature to share any deliverables related to those until we have that behavioral criteria. So I do want to provide that update. We're still working feverishly behind the scenes. Next meeting is July 26th, this room, 9 a.m. A reminder for everyone, and I'm happy to answer any questions.
Okay. Great information today, as usual, Cheyenne. And let me open it to the board for any comments or questions. Yeah. Oh, thank you, Trudy.
That didn't work, did it?
There you are.
There you go.
All right. I know you try very hard to place animals and avoid euthanasia. In your category unknown, there were no interest, 2. How long do they get?
Cheyenne, for the record. If you all recall, I believe it was last fall, we provided an update on our pathway planning, and we talked about sort of a timeline of when animals come into our shelter, when we start that behavioral assessment on our side, which we've never done before. And so we implemented the help of Kelly Bolin to provide an assessment training to my team. And once the assessment has been concluded, if the animal is deemed adoptable by our criteria, of course, the Nevada Humane Society has that first right of refusal. If they opt to pass on the animal, we're looking to turn the animal within 14 days. So again, as a reminder, our shelter is not set up to be holding animals past 5 days. So 14 days sometimes can even be a push for us, depending on what our capacity limits are. So that kind of gives us a time frame to begin escalating it up. So if by day 7 or 8 we haven't had a commitment to transfer an animal, we make sure to ping all of our rescue partners, letting them know this might be the final pass, that we're letting you know this animal's still here. If there are rescues out there that are willing to take it, we hope that you will consider the animal.
Thank you. I have, Trudy Broussard for the record. I had one other question. I probably should have brought this up when we were talking about the minutes from the last meeting. It states in the minutes that if one of your field officers puts their hands on an animal, they must impound it. And if that's literally true, how can you possibly get them reunited in the field? So was that a mistake in the...
That would be my guess, Cheyenne, for the record. We do not impound every animal, as the statistics show. My
Right.
officers would love to reunite them with their owner and not bring them into the shelter and go through all the processing, intake paperwork, and vaccinations, and all of the costs incurred with impounding an animal. So that must have been a typo or an error of some context.
Yes, I'm sorry I didn't bring it up when we were doing the minutes, because I thought, oh, you really don't want that on the record because it can't be true.
No, so what we'll do is after this, we'll revisit the minutes and we'll do our consideration for reconsideration, so to amend that, okay? So,
Right.
any other
Thank you.
questions for our director? Okay, I have just a question, and it may be more of a qualitative assessment. I was wondering, it seemed last quarter and the quarter before, we were feeling quite dire in terms of how things were going, just generally, on all fronts. And I wondered what the feeling is now. How's the morale? What's the feeling in terms, you just went over some significant euthanasia numbers. I wondered if there was a takeaway.
Cheyenne, for the record, I think that the morale and the level of promise, if you will, that we all are feeling, that there's, a turning point. Of course, wintertime is our slow time of year, and so it gives us a chance to take a breath and to really assess things that during the summer and the fall we have a hard time focusing on. But I do think that we are headed in the right direction. We are focusing on how do we align our processes with the Humane Society, and how do we work more harmoniously together, and how do we rectify communication errors. And there's so much overlap in so much of what we do, and so I think that with any leadership change, that is going to occur for the first 6 months to a year. And so I think that Jerlene and I have done a tremendous job of working through a lot of those issues. And of course, the work sessions that we've been doing to work on our partnership and eventually the PSA are going to lead into that, to those improvements and things that will be on record. But for the time being, it's more about assessing where are the organization's needs, where are our weaknesses, where are our strengths, and what do we need to focus on to be better for our community. And I do think that we've done a great job at talking through those things. The next step is let's put them into action, or continue to put them into action.
Okay. Well, on that note, I know you have weekly or even daily meetings with NHS. I'm not sure which, but then did you just say that you've continued to have these team building meetings, which I consider different over
Yes.
this quarter?
So NHS and Animal Services staff meet as necessary, but we have a scheduled biweekly meeting. But we also are.
Is biweekly twice a week or
Every
2
other
weeks?
week.
Oh.
Yeah, so we meet every other Wednesday. And we also meet in between if we need to, but we also just had our first quarterly meeting with the same working group that worked on the work sessions to update the group on where everyone is on some of those things that we talked about in the work sessions, and we will continue to do that through the remainder of the year.
Is that the calendar year or the fiscal year, or what are you talking?
Calendar year,
Okay.
Yes.
So through to 2025.
yes, through the
Okay.
end of this year. I think that's what we discussed and talked about, is let's quarterly touch base, make sure we keep the ship pointed in the right direction. And it's easy to kind of get busy in our own work silos and to not focus on the bigger picture things until it's an emergency right in front of us. So it is very helpful to have those quarterly meetings.
Well, let me point out, and I don't know if anyone else, I have received no letters about either doings at Animal Services or doings at Nevada Humane Services in this quarter. 0 letters. Now, that's either pro or con, but no con, for sure. And I don't know if anyone else has, but I think this is a very good indicator, non-quantitative perhaps, but an indicator that things are settling down.
I would concur.
Okay. Anyone else want to ask any questions or comments for Cheyenne? Okay, seeing none, thank you so much for the report today. In fact, we're going to turn now to item 8, Nevada Humane Society Operational Update Report. And then after the Humane Society, I'll open for questions and comments on both items, 7 and 8. Neither was action item. They're both informational, but I do want to continue to get public input as we move on. Hi, welcome. Welcome to you both, Trent and Jerlene.
Am I not on? Am I on?
I
Okay,
know the
I am
lights
on.
don't go on, so
Yeah,
you
there's
just
no
sort of have
light.
to test it.
Good morning, Madam Chair Dewar and board members. Thank you so much for inviting Nevada Humane Society to provide an update on our Q1 operations. My name is Geraldine Bryant. I'm the CEO of Nevada Humane Society, and I'm here today with Trent Bingham, and he is our Director of Operations. So the first thing that I'm going to talk about is capacity. Capacity is the one word that has such a deep and profound meaning in animal welfare and for NHS. It fluctuates, not just daily or weekly, but hourly, and it drives the decisions that we make. The Reno campus has 142 dog kennels available. Our established capacity for care is 80%. When 80% capacity is reached, our operations begin to be negatively impacted. When we are at or above capacity for care, care must be taken to reduce our population to ensure we can continue to meet community needs for owner guardian surrenders and transfers from our partners at Animal Services. From mid-February through the first week of March, our capacity stayed between 80 and 90%. This was highly uncomfortable for our staff and primarily our dog care team. Adoptions were not keeping up with intakes in the weeks running up, but were sufficient to allow continued surrenders and transfers from Washoe County Regional Animal Services. It was a priority for us in an effort to keep their capacity from reaching levels above their capacity for care. To accommodate this increase in capacity, NHS needed to be less flexible with walk-in surrenders, focusing on the urgent ones only, and working with owners to schedule appointments. On March 9th, NHS had 17 adoptions that day, and this was certainly a relief, and it was a cause for celebration through our organization. My point is that I really can't stress enough what a balancing act this is. I mean, we look at it throughout the day. We see Animal Services capacity comes to us morning and afternoon. We look at our capacity, and we are consistently making decisions so that we can be a good partner and maintain the quality of care for the animals in our own facilities. So intakes. NHS Reno campus receives animals from 5 different sources. We receive transfers from Washoe County Regional Animal Services. We receive owner guardian surrenders. We receive Good Samaritan strays, which are the unowned puppies and kittens found by members in our community. Returns of adoptions, that happens. And then a small category is others, and that would be animals born in our care, internal transfers, or transfers from other partners, or TNR. And this next slide is going to show the breakdown. So for dogs, 88% of our intakes came from transfers from Washoe County Regional Animal Services, owner guardian surrenders, and those Good Samaritan animals, or as we refer to them as Good Sams. For cats, 89% of our intakes came from transfers from Washoe County Regional Animal Services, owner guardian surrenders, and Good Sams. Good Samaritan kittens are kittens found by members in our community. These are the most vulnerable population of animals in our community. They're too young to fend for themselves and will go into our robust neonatal kitten foster program to receive the around-the-clock care required. As Q1 covers much of winter, it is generally one of the quarters with the least number of Good Samaritan surrenders. But we know they are coming, and we're preparing for it, and we are bracing ourselves. Last year, over a period of several months, we received almost 900 of these little babies, which needed intense care and resources to survive. So our intake of dogs is 7% higher than in 2022 and 12% lower than the 5-year peak of 2023. Owner-guardian surrender demand in early 2023 required long wait times for surrender appointments and were insufficient to meet the community demands. It's important to note, though, that owner-guardian surrenders are up 69% in Q1 for 2024 than they were compared to Q1 of 2023. As NHS is the contracted owner-guardian surrender facility for Washoe County, we restructured our program to better match demand and keep appointment times for surrenders reasonably low. I can say that I checked this morning before heading over here, and if a member of our public wants to surrender a cat, they can have an appointment as soon as 3 days from now. And if they want to surrender a dog, they can have an appointment as soon as 5 days from now.
Hey, that's an amazing change.
Thank
from-
you.
I recall it was weeks out.
It was multiple weeks out, yes. A lot of hard work has gone into that, and we're very proud of where we are currently at. Since the middle of last year, we have consistently seen historically high demand for surrenders due to economic strains, housing challenges, lifestyle changes, and that is driving the increased numbers. Transfers from Washoe County Regional Animal Services is down 28% in Q1, likely due to a variety of causes, including the wonderful work Cheyenne's team are doing to reunify lost pets with their owners, and their equally wonderful lower length of stay for first quarter, or last quarter. It's important to note that even with the percentage of transfers being lower than this same period last year, NHS still transferred 83% of animals that were available. And another thing to note is that surrenders, as you can see, our public surrenders are up 69%.
Darlene, before you leave that, and I hate to interrupt, but your flow, but when you said 83% are transferred, does that mean 17%? What does that mean?
It means of all of the animals that were available for transfer at Washoe County Regional Animal Services, NHS transferred 83% of them.
Of animal services?
Yes.
Okay, gotcha. Okay.
So moving on to cats. In 2020, NHS used to transfer large numbers of cats from outside of Washoe County, and that is the reason for those high intake numbers for that year. It's kind of an outlier. And in the second half of 2023, cat housing was upgraded to meet ASV guidelines, increasing the health and well-being of the cats in our care to meet minimum requirements. This did reduce overall capacity at any given moment by approximately 55 to 60%. The good news is that it also reduced our length of stay for cats and allowing us to have only a 14% reduction in intakes, meeting the community needs for surrenders and transfers of strays. In anticipation of kitten season, Q1 has been spent increasing our cat capacity by purchasing and installing more cat enclosures to allow us to adequately house more cats while still meeting those minimum requirements as outlined in the ASV guidelines.
So let me just highlight what I think I heard you just say. You said that you upgraded, which I think you meant doubled the space, essentially.
We're increasing the spaces.
Right,
yes.
but then it said that you then reduced the number of spaces by 50%.
So what I was saying is that in the second half of 2023, so when I came on to NHS, and we talked about this at the last end of January, the last meeting here, we were housing cats inappropriately. We were housing cats that did not meet and align with best practices in animal welfare. So to stop doing that, it meant that we decreased our capacity. It wasn't great timing. I'm the first one to admit that. It was summertime with a lot of cats coming in, but we can't compromise our quality of care for our animals. So while it did decrease at that moment our capacity by about 55 to 60%. What we are able to do is, sorry, I'm getting to my right page. Where am I at?
Well, I think you had said that actually ended up increasing your adoptions, but I'm not sure if that's where you were going.
Well, no, so what it did is because our length of stay, cats that are housed appropriately are healthier and happier, and the correlation is that they get adopted faster.
Gotcha.
So because our length of stay decreased, it only impacted our capacity really by 14%.
I get it.
Yeah.
Okay.
Oh, what happened? Okay. Yeah, there we go. Okay. So our intake of cats. Kitten season, so transfers again, similar to dogs, for cats was down 29%. Our owner guardian surrenders were up 84%, and our Good Samaritan surrenders were up 29%. And we're going to see that trend increase as we get further away from winter. Kitten season has started 1 month early for us and can be seen by that 29% increase in Good Sams. Important to note that surrenders for cats, like dogs, were underserved in previous years. And I am going to turn it over to Trent now to cover outcomes for our animals and the very critical topic of length of stay.
Okay. But one more question
Yeah.
before you leave. What does underserved mean? I don't know that term.
So it goes back to those surrender appointments. We were not doing a good job historically at NHS of serving our community when they had animals that they could no longer keep or did no longer want to keep. We were not addressing the needs of our community in an efficient and proactive manner to provide an appointment within a reasonable amount of time. So,
Gotcha.
yeah.
Okay.
Good morning. So it's a good test to see where the microphone is. All right. I'm here to talk about outcomes and length of stay. For me, outcomes, it's kind of our primary purpose as a shelter. And we seek to provide an expedient outcome for the animals that are in our care. It's part of our mission and where we say find them homes. There's a reason it's one of our 3 bullet points in there. It's a really critical one. Animals primarily leave NHS via adoptions, returns, and transfers. Adoptions, however, are consistently the primary way that they leave our care, and it's really driven by adopter demand, and that drives our capacity and our length of stay for our animals. Looking at a snapshot of Q1 of 2024, we can see that there were 700 dogs that were adopted or returned to their owners in the first quarter of 2023. That's 91% of our total dog outcomes were those 2 categories. For our Reno campus, we don't do a lot of return to owners, so it's a relatively small portion of that. Nevada Humane Society is proud to continue to be a high save organization, and we have a live release rate for Q1 of 95% for dogs. Non-live outcomes include stolen or lost, died in care, or euthanasias. 56% were either died in care or medically necessitated humane euthanasia. Looking at Q1 for our cats, we had 642 cats that were adopted or returned to their owners, and that represents 91% of all cat outcomes. As with dogs, our live release rate for Q1 is 95%. For the outcomes of our dogs, when looking at it over the 5 years, we can see that total outcomes were down for 4% compared to the previous year. However, as intakes were down 12%, it showed that we still had some extra animals in our care, some of our longer stay dogs that we were successfully able to provide outcomes for. Transfers to our community partners and our Carson campus are up 250%. It's providing a renewed pathway for supporting our animals and providing them homes and those who have less than straightforward paths. Adoptions as a percentage of our total intakes for dogs was 88% in quarter one of 2023 and was 93% quarter one in 2024. And this is a handy little number to try to compare how our adoption rates really are going. Behavior and euthanasia outcomes are up, likely driven by the increase of owner-guardian surrenders and behavior of community animals. Of the 17 dogs that were euthanized for behavior, only 3 originated as transfers from Washoe County Regional Animal Services. Too fast. Total cat outcomes were down 14%, and that matches our reduced intake. We do know that whenever we had kittens for this quarter, people were lined up at the door. So we do know that there is demand for them, which is we are greatly looking forward to as the first of the neonatal kittens are starting to come available for adoption now. Adoptions as a percentage of total intake for cats stayed at a constant of 88% between last year and this year for the quarter. Outside of total adoption numbers, 2024 did see an increase of transfer cats, especially to our Carson campus. Wonderfully, during quarter one, we actually got to see that one of our ringworm isolation rooms was completely empty. I had never seen it in the 2-ish years that I've been there. Many others had not ever seen that either. We do adopt out ringworm cats, and that means that our community was wonderfully supportive in that. Adopter demand kept length of stay short, and that allowed us to maximize our space. And we had a more robust working cat program and a return to field program. And that kept our capacity focused on adoptions. Length of stay. Length of stay is probably my single favorite statistic. I've got another one that I really like, but nobody else does. Length of stay is if you're looking at how to measure how we're doing, it is one of our key ones to be looking at. There are a variety of approaches to measuring length of stay. They all have their place. For these slides, we will be measuring days from intake to outcome in our system. It's very simple math measured in days. Lower length of stays are harder. Longer length of stays are harder on most shelter animals, frequently involving increased stress and poor health and poor outcomes. Longer lengths of stays also reduces the number of animals that we can house and adopt in a year. If a enclosure or a kennel is held for a month, which is twice as long as our ideal maximum length of stay, that's half the number of animals that we can have in that same space. For measuring our length of stay, we like to break it down into 6 different durations. In general, the ideal length of stay in our shelter is 14 days. We recently discovered that was when they built our shelter, that was their projections, was that there would be a 5 to 6 day length of stay at Washoe County and a 14-day length of stay at Nevada Humane Society. At a high level view, when you look at it, you can see that 2021, 2022, and 2023 showed that more of our dogs had a longer length of stay. It's not a huge percentage difference when you look at this chart, but you'll see more as we drill in where it can come up. And because of the kind of way that length of stay works, it has rapid effects on our capacity. Quarter one of 2023 had a particularly large increase in the 15 to 30 day and 31 to 60 day durations. Digging in at a more granular level, we can see that 74% of our dog outcomes occurred within 2 weeks of 2024, and that is wonderful. We love seeing that type of thing. A considered operational effort has gone into finding longer stay dog homes other positive outcomes, for instance, transferring to rescue partners where appropriate. And that's the increase you see in the 91 plus days there. 8 dogs were adopted the same day they came into Nevada Humane Society in the first quarter of 2024. That's my favorite length of stay.
Yeah.
I think one of them was literally within an hour. We transferred them over. They were all up to date on all the shots. Had a quick assessment on them, and somebody saw them coming through the lobby and said, I really want to meet that dog. And we're like, we can make that happen.
And would you just say, what is this word again, transfer? Because it means something different in this set of statistics. Before transfer was transfer from Animal Services to you, what does transfer mean here?
We'll transfer out to partners as well. We
To
have
partners?
To partners. We have
Okay.
internal transfer to our Carson campus. We use that, for instance, if we want to get fresh eyes on a dog. We also will do external transfers to partners such as rescue,
Okay.
Paws Abilities, many of the rich tapestry of animal welfare organizations. We're always looking to say, hey, this animal isn't doing well here. You've got a foster-based organization. Maybe you have the perfect foster home for this particular dog. Would you like to come in and meet the dog?
Gotcha. No, that's helpful. Thank you.
The longest length of stay, a dog that got adopted in Q1 had a length of stay of 491 days, so well over a year.
491 days.
For our cats, cats have actually had a strong trend towards shorter lengths of stay. I believe that that's been a kind of a culmination of a lot of efforts to refine outcome possibilities for our cats. 78% of cat outcomes occurred within 2 weeks of 2024. That will probably be even more in next quarters. Once kittens show up, they have a length of stay. Well, it gets wonky with their length of stay, but 12 cats were adopted the same day that they came into NHS in Q1, and the longest stay cat adopted in Q1 was 179 days. And then on to our public services with Trilene.
Really quick, let the record reflect that Mr. Anderson has joined the meeting at 10:17 a.m. Thank you.
Okay, so our public services. NHS provides, of course, a wide variety of support to our community beyond the owner-guardian surrender being the owner-guardian surrender facility and the primary transfer partner of Washoe County Regional Animal Services. So this includes spay and neuter for community cats and our TNR partners, low-cost vaccine and microchip clinics, TNR, working cat adoptions, and support for local community cats. Additionally, by providing pet food to community members to keep pets in their homes with families that love them. There's kind of a breakdown of Q1 of 2024. So we more than doubled our vaccines given versus Q1 of 2023. So Q1 was 2,517 vaccinations for total services of 2,892. Back here a little bit. NHS now has a low-cost public vaccine and microchip clinic available twice a week, Wednesdays and Sundays, and again has doubled the number of vaccines and microchip services we're able to provide to the public. A more formalized support of community colony caretakers allows us to directly support an increasing number of cats staying in the community, with over 15,000 pounds of pet food distributed in the first quarter of 2024. So that 15,000 pounds went directly to colony caretakers or individuals caring for community cats to help feed them. Our program also is ramping up returning cats directly to field and adopting out working cats. So those are the cats that are not have no address to go back to, no colony to go back to, but they are not friendly enough to be in a home. But they have a place in our community and they have a job that they want to do. And thankfully, there are people in our community that want to adopt them and give them that job. We have fielded, our community cats team has fielded and responded to 675 phone calls in Q1 and 740 emails to support the various community members' needs with cats in our community. And that concludes our presentation for Nevada Humane Society. Again, thank you very much for inviting us to share this information. And please be sure to check out our website and social media every Monday for our Metrics Monday. And it's similar to Cheyenne's team's report card that goes out on Thursdays. We do the same on Mondays for the previous week.
Okay, excellent. All right, thank you both so much for being here. I'm sure there's going to be some questions. I just want to ask first, I've been getting your report, but from I've gotten your report sent to me by Cheyenne, by the mayor, by Jackie Bryant in our office, but I don't seem to be receiving it directly. And so what I was wondering is, could you guys check to just make sure all of our board members are on your distribution list?
I know you are on my distribution list, so I will check that email address.
Yeah, maybe it's
Thank
going to
you.
spam,
Yes.
who knows? We don't know. And I don't know if everyone else is receiving it, just a head nod. So maybe it's just
Everyone
me.
but you.
Yeah, and I can't say, I know I saw the last one, but I think for the first 2 months since we met last time, I was getting it. I didn't ask for it, but it kept coming to me, and I was like, wow, okay, this is amazing.
I will double check that, maybe.
The other thing on the report, the ones I have seen are reported, I think it's a text, it's like sentences with numbers in them, at least what I've seen. And maybe I've missed a chart. And I don't know if you're actually putting it in like a spreadsheet or if it's just reported in text. Could you advise us?
It is reported in text. We do have 2 charts that we add on social media and on our website. But the rest of the information is in text.
Yeah. Well, one of first of all, it's awesome that you're doing this. I'm so appreciative. What I was going to ask is, I'm a person, and I don't know if others are like me, but I often need context. I need some kind of a thing to, like you did here today. It was a before and after, or week over week, year over year, something. Like, here's last week's numbers, here's this week's numbers. Something just side by side. I don't know if that's something you could add to your report, if that would add a lot more time, but you'd already have the numbers from last week. And
I hear you. I like charts too.
Yeah.
I think for us, when we are posting it to our social media, we are trying to keep it as informational
course.
yet succinct as possible.
Yeah.
It makes the post too large.
Yeah.
But I think that there are other ways that we can share this information with charts and graphs, maybe monthly or quarterly,
Yeah.
and provide that to the community.
that might be a great idea, just to have it all in one place without having to read. Just boom. Like, your other charts are amazing. Let me open it up to our board for any comments or questions. Yes, Trudy.
Trudy Broussard for the record. I was just curious, why so few dog spays and neuters?
Because, well, I'm going to go back and say that during COVID, like many organizations, we decreased our public spay and neuter program. When I came on in May, we did not have a robust community program for owned dogs and cats, friendly dog cats. We have our weekly TNR program. That certainly is a priority for us moving forward. There are a lot of things that we have to have in place. Funding for one, and bodies for the another. We are currently seeking another veterinarian. We are down several vet techs in our department. So our primary focus is to meet the needs of the animals in our care that have no one else to care for them. And then, of course, we want to address the needs of the community as far as providing access to affordable spay and neuter that meets the needs of the community. So it is coming, but it isn't something that we can just do overnight.
Well, thank you. I understand that. Do you actually get requests and you have to say, I'm so terribly sorry, but we don't have?
Sure, yes. There is a need. There is a need not just in our community, it's a need nationally. But we are here in this community. We do recognize, thankfully, we have some other wonderful partners in the community that do provide that service, but the demand is greater than what any of us are able to meet at this time.
Possibly if you had that statistic to bring to funding agencies, that would help you. I mean, when you say a lot, it could be 15 or 1,500. I don't know.
I would garner to say it's in the thousands, that there is a need in our community.
That might be an interesting flag to wave. Thank you.
Thank you.
So let me just follow up on that. That was, I had made a note too, and I just, so since you've opened the topic, I just wanted to make sure, so what are the plans to address this? I mean, it is a big need. It was, prior to this, the biggest issue that I kept hearing about was that you no longer did, or did at a very limited basis, spay neuter. So what is the, could you say more about it, the actual status and what plans might be?
Yes, Darlene Bryant, for the record. Well, first of all, I can say that both sincerely, no one in this room could possibly want a robust spay and neuter program at NHS more than I do.
Yeah.
So some of the things that we have to have in place to do that, again, we have to have those capable bodies that perform those surgeries. There is a veterinarian shortage
Right.
in this country, and it's very difficult to find those individuals. So we are currently advertising and for techs. So that's the first thing we have to do. Our operation here in Reno is solely donor funded.
Right.
And so it's going to take funds, and we are going to need to get those funds from somewhere, whether it's supporters in our community or some grant funding. Of course, that's it always sounds easier than it is, but there is some out there. So it is, we have to have the bodies and the funding to be able to do it. So absolutely, it is on our horizon.
I mean, are you down of that? I mean, this is what I'm asking. What is the kind of situation, and is there a way that we can help?
Yes.
And the reason I'm asking under your presentation is that if you can't do it, and then our next course is to turn to our animal services, can they do it? If they can't do it, then how as a community
Sure.
do we get it done? And so it's more of a factual, just where are we?
Yeah.
What's the status, you know?
This-
I mean, are you doing any, or are you?
Darlene, for the record. So our status is that we are actively recruiting more bodies to be able to put Nevada Humane Society in a place where we can open up our services to the community.
So right now, there is no spay neuter other than the weekly TNR cats. Is that correct?
Correct.
Are you doing the?
Slightly, like, what?
Sorry, I do want to, this is Trent Bingham for the record. We do, as we can, fit them into our schedule when there's particular need that comes in. Say, for instance, when an owner guardian comes in and we know that all they need is a spay neuter to be able to keep it together, we are working with our clinic services to keep them
So
in
earlier,
control.
we heard about housing.
Mhm.
And is that a requirement for pets to be housed that they're spay neutered, or no?
If that's a barrier, we can try to work.
Oh,
on
if
that.
it is.
If it's-
So can you just say, just a simple, I guess, are you doing any spay neuter now? Like any?
We are, but
Oh.
it's minimal. It doesn't meet the need. It's one-off cases. If we have an
So might that
individual-
be 2 a week or something?
Maybe, yes.
Okay.
I mean, I don't have the
I was just
numbers
trying
with
to
me.
get a
If-
feel for it.
Sure. If we have an individual that is surrendering a bunch of puppies, we want to spay the mom. And so we oftentimes will work very hard to get them to agree, and then we will accommodate that in our clinic.
Okay.
So again, these are urgent situations.
Gotcha.
But we, as soon as I mean, I wish I could give you a timeframe, but I can tell you that we are diligently working on it. Many meetings and conversations happen at NHS about how do we get ourselves to that place.
But it's important for us to understand what the status is. And if it's 2 a week and it's an emergency basis, that is maybe 100 a year, right? 52 weeks. And you said the need might be 1,000 a year. I mean,
Yes.
just trying to get order of
Yeah.
magnitude
Yeah.
here. And so I want to be able to respond. If someone writes in or asks me on the street, are we doing spay neuter? I have a good answer now.
Sure.
On a very minimal basis, not open for the general public.
At this time, but.
Well, right.
Yeah.
And when do you think the last time was, I guess? A year ago that they were doing
No, I
it?
think that I think it stopped.
Many years?
I think it stopped during COVID.
Okay, COVID? Okay, all right. Well, I'm going to continue on to the other board members, and then I have a couple questions for Cheyenne. Okay, go ahead. Anyone have any comments? I'm sorry. Julie?
Julie McMahon, for the record. Am I on? Yeah?
Yeah.
Okay. So I think just to kind of top off this discussion, We talk about veterinarians and staffing and funding, but we have to take in consideration the facility. Like it's small.
Yeah.
That clinic is tiny, and
Yeah.
they are rolling out animals like mad. And then we have to remember that just because we're not serving the public, all of those animals that are getting out for adoption and being prepared, that is a large number of animals that they're taking care of. So I think we're taking into perspective, yes, the public aspect of it, but we can't forget that we're still serving the public in a way, or they are, I shouldn't say we, because I'm not your entity, but that they're still serving the public in a grand way by being able to get these animals out in that way. So
Yeah.
I do want to kind of just highlight that, because I think, yes, we want to do more for the public, and I think that's a general statement between Washoe County and Nevada Humane Society and Options and SPCA and all of these bigger entities. But we don't want to like foreshadow the positive that's coming out of that.
Yeah.
So
Thank you so much for bringing that up, and it is a good point.
Yeah.
I would welcome anyone on this board to come to NHS and see our clinic in action. It is a high-volume, very efficient operation, and true, if you look at the size of the building and then you look at the size of that clinic, it's grossly undersized, and what it does for us is that it creates a bottleneck. There's nowhere to put public animals pre and post surgery. There's not,
Right.
because we have our shelter animals pre and post surgery. It's like a game of Tetris. There's nowhere else to put them, and that is one of those conversations and a topic for meetings that we have internally of how do we strategize physically placing those animals.
But maybe I'm misunderstanding. I mean, are you spaying and neutering every animal that you adopt out?
Oh, absolutely.
So
Yes.
that is the missing piece. You didn't say that.
Oh, I'm sorry. Yes.
Okay, and
We
you
were talking
assumed
about
we knew.
public.
No,
Yes,
no,
sorry.
no. I just
Yes.
wanted to get the
Yes.
broad. So every animal you adopt
It's
out, which is
Many
many,
thousands and thousands.
right?
Yes.
You're making sure they're spayed neutered before you rehome them.
Yes. They are
Okay.
spayed and neutered, microchipped, vaccinated, and their medical needs have been met while
Gotcha.
they're in our care.
Well, I thank you for clarifying, because that was a missing piece for me. We sort of know it, but I have to say in this conversation, it wasn't first and foremost. So it would be still good to know how many of those you're doing, because that's a huge load. That's a significant number of animals that are getting spay-neutered.
I would have to
Yeah.
say that statistically is a pretty high number, since
was
many
high.
of the animals
It
that
was-
you adopt are young.
Yeah, it was over 5,200 animals last year.
Well, I mean, that should be on your metrics, okay? I mean, I think.
I'm sorry, I think this is a case of, I'm looking through this.
I know.
Through this lens, and I have public and then shelter animals, and to me,
Gotcha.
they're separate.
All
So,
right.
Thank you,
Let
Ms.
me see if there's,
McMahon.
go ahead.
I have two more comments. One is, last meeting you had talked about that with your expansion of the kennels for the cats, that you were remodeling some of your rooms. Is that complete? Is that still in process, and how's that going?
That is in process. Trent, you want to?
Trying to bring them for the record. It is in process. It is almost finished. We are doing the final stage of portalization of the first phase of the remodel. It's one of the type of things where we can get some quick rollaway, our rolling kennels of shorelines that have the adequate square footage in there. And then we also have plans in the works for doing a second phase where it's more permanent installation to expand even further on that. And that'll be kind of a 6 to 9 month process for that finalization. It'll probably be up and running within the month, assuming that everything goes well with the next phase, which, as you know, for any sort of construction project is not always a guarantee.
Thank you. And then my last question is originally, Jarlene, you were brought on as like an interim CEO. Has there been something where you have been offered a permanent position? Is there a search? Like, what happened with
Yes.
that process? I may have missed it.
Oh, okay, yes, that did happen.
Okay.
I think it was last July that the announcement was made. My position was posted nationally on the website of AWA, which is the Association for Animal Advancement. It's where the primary place that positions such as mine would be posted. The board offered the position to me. I accepted, and I believe the announcement went out in July or August. So I have been in a permanent CEO position since then.
Thank you. I just missed that somewhere along the line, so I
Sorry.
appreciate that. Thank you.
Yeah. And then a comment from me. I would be remiss if I didn't recognize the terrific town hall that you had, which happened since our last meeting. Several of our board members attended. I think you were there. Several of us, and I was impressed with about half of NHS's board was there, I would say. At least 4 members I saw. And I think about three of our board members were there, meaning there was great interest. I think Mr. Anderson was there, Diaz was there, I was there. So, we all obviously have great interest. I was wondering if there was going to be another town hall.
There is. I believe it is, Cheyenne, is it scheduled for May 22nd? I believe it is May 22nd that it is scheduled for.
That is correct.
Okay.
I was just verifying.
Town
Okay.
hall?
And so
Same
we
location,
will
or-
be, same location. I would imagine in the next couple weeks, you will start seeing things on social media,
Okay.
maybe from both of our organizations, and with that announcement for the
Okay,
date
cool.
and time.
Again, let me turn to any other board members like to comment or question. Mr.
Diaz, for
Dixon?
the record, I just want to say great job in communication.
Thank you.
Okay. I asked you about the town hall, and then I was going to, since we were talking about vets, I was going to turn to Cheyenne. I had said we were going to, take both together in context. What's our status with our vet over at Animal Services?
Cheyenne, for the record, we hired Dr. Slayton. She started on April 12th, I believe. Is that right?
So just 2
March-
weeks ago.
March 12th, sorry.
Oh, March 12th.
So
Okay.
she's been with us for just
About a
over a
month.
month, and she's getting her feet on the ground, starting to help us with protocols and building our medical program, ordering supplies and things that we're going to need to be able to fully perform all the functions that we need to for our animals in our shelter. We don't have x-ray machines and things of that nature, so we're going to have to acquire quite a bit of equipment
Okay.
and lab items.
Very good to know.
So yes, we are on our way.
Okay. I have one more question for you that's kind of sensitive, and I don't want to keep you standing here, so I don't know if there are any more questions. Thank you so much. It's so helpful.
Thank you very
I
much.
did see what Julia shared with me, what was posted on your website, which I missed. The way that you put the numbers very specifically on one of your posts was very helpful. The other post was what would we call the text presentation. The reason I don't find that as helpful is there's just no context. You don't know, is the number 452, is that a lot, a little? If you're not a regular consumer, if you're not you, we don't know. And the average public cannot know, is that a good number, a bad number? We want to celebrate your success. And we also want to support you through the challenges. So I think, just think about it, about adding that either at the end of the text presentation or something would be helpful. Okay? All right. Thank you so much for being here. I'm going to ask Cheyenne a question really quickly, and then I want to open it to the public. This is a sensitive topic, and it was in your bailiwick this quarter, so I think it's appropriate to ask. So we had this unfortunate dog shooting in a park, and I know you were doing an investigation. I just wondered what the status was, and if what I really want, the reason I'm bringing it up is that if there are things that you find that you think that we as different jurisdictions, Rena, Sparks, Washoe County, need to change our rules, regulations, or anything to address this kind of situation, then you should advise us once you've completed your analysis. But I just wondered what the status of your analysis was.
Cheyenne, for the record, happy to provide an update on that tragic situation. Animal Services was called out as the animal control organization in addition to law enforcement, who was already on scene. And we conducted our investigation, and unfortunately, with situations like this, you have witness statements and you might have additional information that can help you in your investigation. And in this situation, the only 2 witness statements that we have that have merit to what happened leading up to the shooting were the 2 dog owners. And so that's very difficult to ascertain whether or not the person was overbearing in their decision or the other dog was the aggressor. And so we have concluded our investigation. We have not received any additional evidence that would help lend any decision or change a decision in the direction of, we don't have enough evidence to charge the gentleman who discharged his firearm with animal cruelty. Keep in mind that Animal Services' only jurisdiction falls under animal welfare issues. So we don't have any jurisdiction over discharge of a firearm.
Right.
Or any of those types of violations. And so for us, our investigation is closed. We do not have any evidence to lead us to believe that he was retaliatory in nature, that he fired the gun after the dogs were separated. Again, we have the 2 witness statements from the 2 dog owners that the larger dog had the smaller dog in its mouth at the time of the shooting, and he felt that his property or his livelihood was being jeopardized, and so he discharged his firearm. In terms of moving forward with this is something that Washoe County Parks Superintendent and some of my team, I'm hopeful that Kelly Bolin will join us and join forces with us. We would like to turn this very tragic event into an opportunity to put something positive out into the community and hopefully regionalize it with some infographic type signage with our regional parks. And so we'd like to work with City of Reno and City of Sparks and also our Washoe County Parks with some type of signage that helps with not only the common sense things that you should be aware of if you take your animal to a park, but how to separate a dog fight safely and how to recognize animal behavior. So we have discussed that, and my hope is that we can move forward with that in the next few months on a plan and see where we go with that.
So some areas of inquiry I would like to recommend, since you just sort of gave us the download. One of the things you said hampered you was lack of witness statements. And perhaps when you're evaluating this going forward, maybe in this kind of tragic situation, emergent situation, maybe more than 1 or 2 officers respond. So in our police officers, for example, when it's a higher level of incident, more people respond. If it's a fire, if it's a structure fire, more firefighters respond than if it's a car fire. So on and so forth. So I know you don't have a lot of resources, but I also know that given the amount of community interest in this kind of thing, that to protect yourself and to be able to do the best job, that might be something that you look at. Or coordinating with either the sheriff's office or the Reno police or whatever to engage them in the process so that they can help you, not just stand by while you figure it all out, but be an active part of your investigation. You see what I mean? To enhance your resources.
Absolutely.
Does that make any kind of sense? I don't know.
It does. We debriefed this call afterwards, and we did have 3 animal control officers respond.
Wow.
Unfortunately, the information that was relayed to us from a first responding agency was that it was a business, not the San Rafael Dog Park or off-leash area. And so one of the officers that responded was brand new, literally on her own for a month. And so then the additional officers that showed up, one was also brand new in training still. So we did the best we could with what resources we had available and the information that was given to us. However, definitely we debriefed this and talked about ways that we can support one another and definitely call in all hands on deck when we have these types of calls.
Right.
Because of the vast acreage of the park alone.
Exactly.
Made it very challenging and difficult to manage the scene and to be able to witness, interview witnesses and things like that.
And yet witnesses came forward on social media and other areas saying, this is what I saw, this is what I heard, and were engaged with the shooter afterwards. And so there's more happening here that you guys cannot possibly, get your arms around in the moment. The other thing I wanted to ask about was, or mention, is that it put a real damper on the safety of dog parks. This is an off-leash area that's not a contained area, to my knowledge. Now, they were talking, and maybe I don't know what improvements have been made at Rancho San Rafael, but my experience there is it's just been an open dog run area, not fenced in for small dogs and large dogs and that kind of thing, right?
It's a shared use area.
Right. So it really put a damper, and people are like, I'm not bringing my dog to a dog park anymore because someone might shoot my dog and there could be an altercation with the dog. And we've worked very hard in Reno to create new dog parks. We've created one in downtown. We've created one at Virginia Lake. They've created one out at Somerset. I mean, we have been actively working on it, and it's really was disturbing to get suddenly a dog park is considered a non-safe space. And so we need help. If that's, perhaps advice you have for us at the cities where we're creating these things, if you don't think we should create anymore or you think we should design them differently, then we need that input too, as cities and as jurisdictions.
Sure.
Yeah. And then lastly, another issue that came to my attention was when we define, I know this is an NRS, but when we define dogs, animals as property, which is commonly done. It puts them in a different class in terms of what they can be charged with, how we view it. And I really do believe that opinions and viewpoints about animals are changing. And so many people, I think COVID put a spotlight on it too, so many people view these as members of the family. It's hard for them to accept that it's okay, to deal with your property this way. And so it's just something I'd like you to just give some thought to, for going forward, maybe not next meeting, but just what is the appropriate role? Have other states or communities, cities change those definitions? Do they have maybe there's more than two categories. Maybe there's not just property and life, but there's animal life, and that's given its own category and, regulations, statutes, et cetera. So just some things to think of that I've been thinking about since the incident. I don't know if anyone else has some thoughts or comments, but a lot to think about. Yes, Mr. Anderson.
Actually, along those lines, I just want to make sure, I thought, my understanding was that in the dog parks, they were supposed to remain on a leash if you did not have voice command control over your animal. Is that incorrect?
So let's discern the two. We have dog parks where it's fenced and controlled environment, and animals can be off leash or on leash, whatever the owner's preference. And then there's off leash areas that are not fenced and contained. And so animals have to be on recall, otherwise your dog will run off because it's not a contained area. So those are two different distinctions. In an off leash area, you might have acres of area that an animal can roam, and so the dog owner may or may not be engaged with the activity of that dog, depending on how far away it is. In a dog park, it's a little more closely confined. However, there can be a lot more dogs interacting in that small space. So there are two different distinctions for animals, but neither of those are they required to be on leash. They're not required to be either on or off leash. It's their choice.
All right, thank you.
Okay. And Ms. Garcia?
Thank you, Madam Chair. And along these lines, and thank you for the update, I drive by Rancho every day, and I still cannot, it's still gut-wrenching for me. Like, I know it was traumatic for a lot of us to read about it and put ourselves in those shoes on both sides. I mean, it's just a horrific offense or event, and I really do appreciate your efforts in communicating with Parks and Open Space and our Parks team, because the messaging and the signage, I think, is really a proactive way. And to your question, Mr. Anderson, there's so many gray area issues. People don't know the definitions. What space is this? And I think clearly delineating, this is an off-leash area. These are the rules here. Here's something you can keep in mind for best practices. I look at retractable leashes differently just since the incident happened. Like, I had no idea. I've been buying retractable leashes my entire life. So that kind of messaging and outreach and education is really critical because we don't want to lose these amazing dog parks. It's a big point of pride. The Rancho San Rafael is a jewel of it's one of our biggest assets here regionally, and so we don't want to put a damper on that, and we just want to educate and come out of this a lot stronger. So anything we can do on the county side, please let me know.
And then, Mr. Dixon, did you have? I didn't see. Did you? Okay. Okay.
I just had
Okay,
a quick question.
Madam Chair, just real quick, Jen
Yeah.
Gustafson for the record. I don't want to get into a quorum discussion of dog parks. We can certainly agendize
yeah.
that for the next meeting.
Well, absolutely. I was just putting it out there for a future agenda item, like input to us. This is why we're here. We need a robust, open discussions with our animal services, especially the things that we're doing that affect what you do. So, we need to be in concert, and we need to be implementing best practices. So if you do, I wasn't thinking of it even as a future meeting. I thought it was something you would communicate to us at our jurisdictions, some best practices. So, Ms. Larson, yeah.
Trudy Broussard for the record. Well, given the advice we just got, I don't know whether I should add anything more. We'll put this to the time when it's appropriate. Thank you.
Okay, good. All right, well, let me I do want to open it to the public. Public's here, it's the right time. I don't know if we have any public comment either on or off Zoom in the room. Okay, very good. I just wanted to give that opportunity. And then we're going to thank you both, to NHS and to our director, for all of this excellent input. Okay, we're going to move on to item 9. And so we have, let me just do a time check and all. So we have item 9 on fee, and then item 10 on the animal evacuation trailers. Two of us, just to put everyone on alert, have to leave by 11:30. So, but there'll still be a quorum, and we'll be handing the gavel to Mr. Anderson if we're still in process at that time. So we'll go back to item 9, which is about fees and fee waivers, fee changes.
Thank you, Tammy Jennings, for the record. I just wanted to bring a couple updates from our last discussion about our fees. So one of your recommendations was to take a look at the fees that were increasing more than 100% and possibly implementing a phasing those in for these fees. So we looked at the fees that will be increasing more than 100%. The cat impounding, livestock boarding, animal disposal, the variance permit annual fee, a dangerous dog annual fee, the exotic animal permit annual fee, breeder's permit annual fee, and the commercial animal welfare permit annual fee. First off, I want to start with the cat impound, livestock boarding, and disposal fees. They're increasing more than 100%, but they were fairly low to start with, so we don't feel it's necessary to do a phased increase of these fees.
Could you remind us what the number is?
So the cat impound fee will go to $60
From, though?
from $28.
28 to 60. Okay.
Livestock boarding fee is currently only $11. It will go to $43. And then the disposal fee is currently only $10. It will go to $36. So those fees, we don't think really require a phased implementation. The fees that we are going to concentrate on for a phased implementation would be the variance permit annual fee, the dangerous dog annual fee, and the exotic animal, and the exotic animal permit annual fee. The breeder's permit and the commercial animal welfare permit, we're going to have to put those on hold to start that because we need to do business impact statements and stuff on those. So that's going to take a little bit more time for us, so we're going to kind of put those off. So for the phased increase, we are going to look at just the variance permit, dangerous dog, and the exotic animal permit. So we were considering doing a two-step process, starting with and I'll just use the variance permit as an example. So doing it in a two-step process, so 2 different years. So if this goes through and we can start January of 2025, the phase would be, first phase, we'd increase to $200. In January of 2026, we'd increase another $200 to get it to that $400 range, so that we've got 2 years that they can get ready for that final fee increase at the end. So that's kind of how we're going to approach it. So for dangerous dog, we'd start with $250 for the first year, and then add another $250 to get it to the final fee of $500. Exotic animal, phase 1 would be $125. Second phase would increase it to another $125, which would be the final total of $250 for those. So, and like I said, the commercial animal welfare and the breeder's permit, we have to do business impact statements and surveys and things, so we'll have to put those on hold for just a little bit.
Okay. So I'm going to make a recommendation. First of all, thank you for looking at it and making these recommendations. 3 of us are on TUMWA, myself, Mr. Anderson, Ms. Garcia. And at TUMWA, when we do rate increases, which they could be significant, we often will approve it, but we will ask for a check-in at the second phase. We've done phasing there too. And we want you to get our concurrence before you do it. Now, I know we're not directly regulating you, we're your advisors, but I still think it'd be a good thing to come back before you raise that fee to the next step, to give us an update on what's happening. This would just be my thought and my request, but I don't know what anyone else thinks, so I'll just open it up for conversation. Anyone? On the fee, happy with the proposal? Yeah, Mr. Anderson.
Thank you. So actually, I do like that check-in, because if all is well in the world, who knows? Maybe we'll go, we don't need to increase as much as we thought if things change. But I do like the check-in. If nothing else, it's a public forum where we can now discuss it. So I do
You
like
do
that
like that?
idea.
Of course,
Thank you.
yeah.
Okay. Any other thoughts on these fee increases? Okay, do we need a motion on this, or?
Well, I've got a couple more
Oh,
things. you
I'm
guys wanted
sorry,
to
I
bring
didn't
me.
realize. Go ahead.
No worries. So the next thing we talked about are some automatic fee waivers that we were wanting to look into. So we wanted to spell that out just a little bit more for you. So we've looked into a total of 10 fee waivers. 7 of them will be automatic waivers. So anytime we do this particular event or something, it'll be an automatic fee waiver. 3 will be discretionary, so basically decided by Cheyenne whether or not we're going to, at this event, do these fee waivers. So I'm going to kind of explain that just a little bit. So to start with, we would like to waive licensing fees for adoptions through our partnering shelters, Nevada Humane Society, SPCA of Northern Nevada, and Pet Network. So every animal that leaves as an adoption will already be licensed, and that first license will be free for them. So we can get them in their system and keep going with their future licenses, hopefully. Another one would be fees for those experiencing homelessness, and the fees that we would be waiving are the required and core vaccinations that we do for them and the licensing fees for them. So which the required vaccination obviously is rabies, the core vaccine being the distemper parvo vaccine or the feline distemper for the cats, and then the license for the dogs. So if you're homeless, going into like our place, you're in CARES campus, something like that, we want to waive those fees for them. Another one would be for our senior vaccine clinics. So our seniors, all the adults over 60 who have pets in our community, when we have a senior vaccine clinic, we would waive the fees for the same fees there. Rabies vaccine, distemper parvo, feline distemper, and the licensing for them as well. So those are at senior vaccine clinics. We also want to put in a program for first-time impounds. So if your dog comes to the shelter, you come down and pick it up within 24 hours of impound, we would like to waive the impound fees for that. So to encourage people to come down sooner rather than later to pick up their dog or their cat. So these would include, this would be the boarding and the vaccination fees for that very first impound. It doesn't include a license. It does not include any vet fees that may have been incurred in the time they were there. But one requirement would be that this is an animal that leaves the shelter microchipped. So if they don't already have a microchip, they have to have a microchip when they leave. There are still some people that don't want to microchip their dog. We want, in order for you to get this free fee, your dog has to be microchipped or your cat has to be microchipped before it would leave. Any other impound of that animal would be at full price. So if your dog comes in 6 months later, that one isn't at full price kind of thing. It's only the first time, and it's only if you pick up your animal within 24 hours. The next one is the variance permit fees for the owners and operators of a rescue organization that uses their residents for foster animals. So the people that have started, the owners and operators, not every single foster, just the owners and operators of that rescue organization. So the organization must be in full compliance with all Washoe County codes. They have to be in good standing with WCRAS, and that they are actively transferring animals from us into their programs during each calendar year. And then the next one, so impounding, boarding fees for, and vaccination fees for significant incidents or accidents in which the owners were transported to the hospital and they can't take care of their animals temporarily. A natural man-made disaster such as a fire, flood, hurricane, tornado, and the animal owner was temporarily deprived of their ability to provide humane care. So if your house catches on fire, you can bring your animals down to us. We'll hold them for up to 5 days, no charge. Domestic violence, if you've been involved in a domestic violence situation, the same thing. Or the death of an owner and the animal is being redeemed by their next of kin or somebody that they have designated to come in. We really don't feel it's fair for somebody else to pay the price after the owner's passed away. And we want to get those dogs back into a happy home kind of thing too. And then the other one that we're discussing is surrounds the dangerous dogs and vicious dogs. So if your dog is impounded by us and there potentially is a dangerous dog hearing and you've decided because of the circumstances there's going to be a dangerous dog hearing, you think it's best to surrender that dog. If you decide to surrender that dog within 5 days of the impound with us, we'll waive those boarding fees. So we're not potentially extending this out. The other thing we would like to do is if your dog has been declared dangerous, if you surrender the dog to us within 5 days, we'll waive the boarding fees as well. Part of the reason we would like to do this is because we see a lot where people will just kind of put it off and put it off and put it off and put it off. The dog's been there for now 60 days, 90 days, that kind of thing, and it's still the same outcome it would have been at the 5-day mark kind of thing. They're just kind of stringing that whole thing along. So we would like to be able to offer that to encourage if we've got a dangerous or vicious dog that needs to be surrendered to us, that it's surrendered sooner rather than later, is what we would like to do. So these are our automatic fee waivers that we would like to hopefully put into place. And then some discretionary fee waivers, licensing fees at outreach events. So we might have a special event where we're at, say we're at the balloon races, people can come in and license their dog for free while we're at the balloon races, right then and there. Fees for service at special outreach events. These would be vaccination events, so the required and core vaccines, dewormer, and licensing at a special, along the lines of a senior clinic, but if we want to just promote vaccinations and licensing and stuff at a special outreach event, we would like to be able to waive those fees. And then we're asking to put into place an automatic admin fee for clinics. So if you make an appointment, there's a $10 charge to make an appointment and get set up to come to one of our clinics to cover our cost of the computers, our outreach coordinators' time, all the paperwork, all that kind of stuff. But at some of these special outreach events, waive that fee as well, kind of thing. So those are the discretionary fee waivers. So it would be up to Director Shull to say, okay, this is going to be one of those special events where we're going to do free vaccines and free licenses to promote that in our community.
All right, is that the presentation?
The next step would be to bring all this to the Board of County Commissioners in the summer of 2024. So that's kind of where we're headed.
All right, well, I'm just going to weigh in. I'm amazed by your kindness and empathy for these automatic fee waivers that you've proposed. I mean, they're very, very thoughtful. I mean, incredibly thoughtful about the duress that people are under, the stress that people are under, the stress you are under, how very emotionally charged some of these situations are, whether it's a death or a dangerous dog, any of it, all comes with a different level of emotion, anxiety. And I think it's very good that you're thinking this way. I really do. You do too. Secondly, on the only other thing I wanted to say is the ones where you're giving discretionary, I personally would give one more category, and that would be, and maybe this is, for our attorney, maybe it's too general, but I think that the director should have the ability to do a variance under special circumstances that we haven't thought of here. Okay? Something unique that she says, wow, I think, I want to do this. It would be infrequent, but I don't want to, continue to have your, yourself in handcuffs about what you can and can't do. So I'd love to see one more category of discretionary fee waiver that would be up to her judgment. And most directors that I know, a variety of agencies, statutory agencies, have that kind of authority. Let me give you one example. Our director of permitting has the authority under, very unique circumstances to waive a certain regulation or requirement. And that's laid out, that they have that discretion. That's why it's called discretion, right? It's up to them. And then they're judged by their boss about how they use or misuse that discretion. So anyway, I don't know what other people would think about it, but Ms. Garcia?
Thank you, Madam Chair. And you took the words right out of
Oh.
your mouth, like both points.
Really?
exactly.
Both
Yes.
points?
So
Oh.
I just wanted to say thank you for the thoughtfulness and kindness to think about our vulnerable populations, including our homeless senior and victims of domestic violence. The one population I was kind of thinking about, which leads me to your second point, was, we have some quite a lot of low-income families in the community that may not be able to make it to the outreach event or these specially timed things. And at the discretion of our director here, I think that fourth bucket would be really helpful. In addition to that, I think for those of us that have discretionary funds, maybe having a funding mechanism in place so that if other council people or commissioners wanted to donate to that discretionary fund, where we could provide additional access to our low-income constituents.
Tammy Jennings, for the record, our CARES program kind of falls into the category you're talking about. So we do have a fund which anybody can donate into our injured animal fund or the CARES program that we use for those type of things to help with people that they may not be homeless, but they're low income. We do have a criteria that has to be met, just so we're not, we don't lose all that money really quickly. But so we do have some of that too already in place. But yes, our injured animal fund and our CARES program are
And
used
that's
for that
from
kind of thing.
community volunteers are donating.
Yes,
Right. So, and I think Ms. Garcia is talking about us ourselves.
yes.
Any elected office, they usually have some small, it's often small. I think ours is much smaller than the county, for example. But I generally do reinvest in our city programs with my discretionary funds on areas I feel that are underfunded. And so it might be, for example, I started hazardous and e-waste recycling. Then it took hold. The whole idea was to do a pilot and, et cetera. So.
Yeah, and so that would be great for that type of stuff. Our CARES program helps with people who have animals that they're in need. Our injured animal fund is used more specifically for animals that we may pick up, that there's something wrong, we have to go to the vet hospital, get them looked at, something like that, or along those lines. So we have kind of two separate buckets for that type of stuff.
All right, anyone, Mr. Dixon?
Yes, Di is here for the record. I just want to make sure, I really like the idea of the discretionary piece, because we could go down a rabbit hole, of course, naming all kinds of groups, but, people with disabilities in particular, it's such a huge impact on their life when they have a pet, so I just want to make sure they don't get left out.
So let me ask our attorney, is it possible to craft a change in the county ordinance to allow, while we're fixing this, can we also give that, through ordinance change, could they give Cheyenne that authority?
Well, I have Jen Gustafson for the record. I have provided legal advice on that, and that is not my advice to create
Understand.
a general
Okay.
category. There are
All right.
some legal issues with
Right.
doing that.
So it sounds like, so far, it is our advice. And so whoever, the Board of County Commissioners will have to kind of weigh in on, and luckily Ms. Garcia is there, so she can carry our thoughts when that comes up, right? She could provide a point and counterpoint on this issue. Mr. Anderson.
First, I want to say thank you very much for staff working on this. I'm sure it's not fun or easy, but addressing it's critical. So I want to say thank you very much for the time and energy you put into it, as well as the compassion. With that being said, I just want to make sure I heard you correctly, Tammy. In my opinion, I don't think necessarily we need to have that second, or the fourth bucket, because if I understand, it would almost be like duplicating this CARES fund that we have. Am I misunderstanding that?
It possibly, yeah, it could, because the only difference might be is we do have specific parameters for the CARES fund. They have to meet a specific criteria. So depending on how things were outlined as far as Cheyenne's discretion to remove fees will help with a certain amount of money towards vet bills or that kind of stuff. So that kind of, it could.
Okay.
So.
Thank you.
It sounds like it might be a subset. Like you're saying,
Possibly.
explaining its criteria. One of those criteria is probably not developmentally disabled people, is probably not in that criteria today, as an example.
Depending on their situation, but that's, as far as Diaz's point, as far as for the disabilities, we can definitely kind of look into that a little bit. We didn't focus on that specifically, we could take a look at that.
So I think we think about as many things as we can think about, but what I do know is that these kind of laws are always imperfect, and there's the unique situations that come up. And I can't imagine them coming up very often, but they do come up, and I don't want to hamstring our directors, so that's just what I think. Any other comments on this side?
Doesn't sound my own. The waiver of a fee, if you get right down there, so the animal isn't impounded for an extensive period of time. I was just thinking about how, this is probably just stepping out of this arena, but you have left your animal with a pet sitter, say a college freshman. They come back and the pet's gone, and they're responsible. They run down to the shelter and say, I lost the orange cat. Is it here? Well, who are you? Well, I'm the pet sitter. Well, we can't give you this cat. This cat belongs to somebody else. No, I'm the pet sitter. They told me I could. Now what do we do? Can you give them the pet?
Have we run into this?
Cheyenne, for the record, this gets into the ownership dilemma. We don't release pets to people that are not,
Registered
that do not own them, or there isn't a designation on file with our department that they have the authority to pick up that animal. And so if we're able to go through the avenues of contacting the owner via phone, letter, email, get verification that this person has permission to pick up the animal on their behalf, then we will release it, but not without that, because there have been cases where we have had people come in pretending to be the owner and they are not the owner. And so we take that very seriously. However, with that said, my staff will go above and beyond to try to verify that the owner has indeed given permission. And so that educational component comes to play, that it's very important to make sure that you have secondary information on file with Animal Services if there is a routine pet sitter or a family member that you want to be able to make decisions on your behalf.
So maybe as part of the education process, just like you have a healthcare proxy or healthcare directive, maybe there needs to be a system like that, a formalized system. I mean, a whole new idea, but you already have these on file, it sounds like.
We do, yeah. Under each animal owner, there's an opportunity for an alternate to be listed as well.
Okay, good to know. All right, any other questions on this? We're on fees and waivers. All right, and you need direction, so I need to pay, we're here for possible action, so I should take public comment. Is there any public comment on this fee or fee waiver issue? And our clerk is saying no, just making sure. I don't even see anyone online now. Okay, well, I'm looking for a motion that would summarize our general thoughts. You want to try?
I am here, and so is the red light. All right, so that is just for the record, but we're leaving out the general, are we leaving out the piece that allowing the director to have the?
No, I mean, I would like to see that in the motion myself, and it sounded like at least 4 of us thought that was a good idea that spoke about it. I mean, the attorney will have to advise the Board of County Commissioners what her legal advice is, and also either, Cheyenne or Ms. Garcia will have to advise what the advisory board's advice is, and the Board of County Commissioners will have to make a decision. I mean, attorney's advice is advice, and boards occasionally go against the attorney's advice. It's not like a black and white, cut in stone, this is it. That the role here is to keep us out of trouble and give us good advice. Same for the Board of County Commissioners, so.
Okay. Well, I'd like to make a motion to adopt the authority for the director and her staff to be able to issue these waivers for the fees to increase the opportunity for pet ownership.
Okay. Well, in a broader
missing a
sense,
piece.
do you want to, maybe, this is an idea, recommend adopt a staff recommendation, which sounds like they've laid out which fees they'd like to move forward with and which fees they'd like to phase in? That would be one thing. 2, on the phasing, whether they're going to come back to us before those take effect or not. Okay? And then 3, if you want to add a 4th category for discretion. So those are 3 things that might be in the motion.
I see. That's a lot.
Okay,
And
do you want to
those
just
pieces.
say what I said?
So yes,
Can we-
let's just go ahead and say what Madam Chair just said, adding those pieces to amend the motion.
Okay. Is there a second?
Okay, real quick, Jen Gustafson for the record. So I would just recommend also just taking a look at the agenda item because in a broader sense, they're asking for your approval of the proposed fee schedule
Right.
itself. And then, of course, the fee waivers that they've presented to you, and of course, with any modifications that you have, and then the incremental stepped increases. So just a, recommendation.
Further
to kinda-
clarify?
Yeah, just to look at your agenda item as you're kind of going through your motion.
Okay. Do you want me to try again? Would that help?
Yes.
Okay. A motion could be to recommend approval of the proposed fee schedule, the proposed fee waivers, the proposed fee phasing, with the exception that we're requesting that the staff return to the board prior to implementing phase 2 of the fees. Okay. And then finally, that we add a new category of discretion, a fourth category to the director. Did that cover it? Okay. Is there a second? Okay, so I made a motion and it was seconded by Mr. Anderson. All in favor, please say aye.
Aye.
Aye. Any opposed? All right, motion carries unanimously. Excellent job, staff. Excellent. Our last item of substance is going to be item 10, and this is about the new emergency animal evacuation trailers.
Jen Gustafson for the record before we get started. Just let the record reflect that Commissioner Garcia has left the meeting at 11:16. Thank you.
Okay, thank you.
Cheyenne Schell for the record. Good afternoon again. This item is to talk about the award of 2 evacuation trailers that Animal Services received recently through a grant from Homeland Security. And so I'd like to give just a little context to how we ended up with the trailers, going all the way back to the Caldor fire. I think everyone can remember what a difficult situation that was for our region to try to help accommodate all of the evacuees from various areas. Animal Services also struggled with trying to provide housing for the evacuees and their animals, basically because the animals were not initially allowed inside of the facility where the humans were. And so this started a conversation related to how can we do better for the animals in our community, and how can Animal Services have more leeway in terms of responding to evacuations and disasters. And so for those of you who have toured Animal Services, you've likely seen our resources. We have trailers that have crates and bowls and equipment to set up an emergency shelter. And it's quite cumbersome and difficult to set one up in a short amount of time. And it's also difficult to be agile, if you will, in terms of being able to respond and get those evacuation shelters set up. And so during this Caldor fire, we learned that these evacuation trailers exist in southern Nevada for one of the jurisdictions down there, and that they utilize them for emergency evacuation setups. So we, with the assistance of our emergency management in Washoe County, applied for a grant with Homeland Security. We received 2 of these evacuation trailers, which are fully contained with caging, air conditioning, water, hot water, drainage, so that we can house cats and dogs. They're not large enough for livestock, but we can house cats and dogs wherever we need to go, virtually.
Amazing.
So they have a generator that runs a 20-gallon fuel tank. We have about 5 to 8 hours of run time on that generator. It holds 30 gallons of potable water. Again, I mentioned we have a hot water heater so that we can disinfect and clean properly. We have 2 AC units on each of the trailers, and then 2 fans to help with air distribution. There is a total of 10 small animal cages and 13 medium cages, which if we remove the divider, we can create large cages to equivalent 6 cages. So we have one here outside, so at the conclusion of the meeting, I would like to offer the board, as well as any members who are in attendance, to take a tour. I have staff on hand who are going to demonstrate how we will use it in an emergency. And we are also doing a press event next Tuesday April 30th from 10 a.m. to 12 p.m. We have a press release that should have gone out yesterday related to that, where we're inviting the public and the press to come and see how these trailers will be used in an evacuation and will be fully set up and functional. So we're very excited, and I would say we're hopeful that this is going to help us significantly this fire season and many seasons to come to set up emergency shelters much more rapidly and efficiently. There's room for storage on board, so we don't have to carry around a bunch of those supplies and the extra things that we would ordinarily have to do. But I think the most important thing is that it will help us to deploy and be set up in a matter of minutes rather than hours that it would take previously.
Wow.
And so we're super excited about that, and we wanted to share that with all of you. So we hope that you will stay after the meeting and take a tour, or you can come to our press event next Tuesday. I'm happy to answer any questions.
And you said it's 10 to 12?
It's from 10 to 12.
Okay.
On Tuesday.
All right. Any comments, questions? Okay, well, I'm just going to say it's amazing. Congratulations. Do you know what the grant fund amount was?
Ooh, each of the trailers was approximately 70,000,
Okay.
somewhere
sounds
in that
about right.
ballpark, and then we paid to have them wrapped with our branding.
Oh, cool.
Yes.
That's fantastic. All right. Well, good work. Very exciting to see that. We will close out this item. Thank you so much for the work in this area. That will totally improve things. I mean, what a
It will.
change.
Yes.
What a change.
Madam Chair, Jerlene has asked to clarify one of her statistics. I don't know if you want me to just give you an updated
Yeah, that'd
statistic
be
on that. When you asked the question about how many total spay and neuter surgeries, she quoted 5,200, which was actually their vaccinations.
Oh,
Their spay neuter surgeries were 7,206.
7,206. Wow. For spay neuter. Wow. Okay. Thank you very much. I'd like to go back to our minutes approval, and I would like to reopen that. So I'd like to get a motion for reconsideration. Anyone?
Move to reconsider.
And is there a second?
Julie McMahon, for the record, I'll second that.
All right, so we have a motion by Ms. Broussard, second by Ms. McMahon, to reconsider. All in favor, please say aye. Aye.
Aye.
Any opposed? All right, we're going to go back to item 5, which is approval of the January 26 minutes, 2024. And then it's been brought up that there was actually an error in the minutes. I don't know if any of our staff could, if we need to reword it right here, Jen, or if we can just direct staff to delete that. What's your recommendation?
I've taken the opportunity to look through the minutes, and I am not able to locate the section that Ms. Broussard is speaking of. So if she could please clarify, I'm happy to make those corrections.
I was just trying to find it again myself, and I hope that I can find it and report.
Okay.
And,
So-
and there is a typo on page 23 that I at least knew where
Okay,
that was.
well, we could clarify typo on page 23. And then if anybody does find future errors in the minutes, you can always come and ask to, as long as it's the next meeting, we're allowed to reconsider again the action that we took and amend. So why don't we just get a motion to approve the minutes with the one typo fix? Okay, anyone?
So moved.
All right. And a second? Anyone?
Julie McMahon, for the record, I'll second that.
All right, so we have a motion and a second to approve the minutes with the one typo change. All in favor, please say aye.
Aye.
Aye. Any opposed? All right, motion passes unanimously. And now we'll go back to item 11, and this is about any kind of either board member or staff announcements, requests for information, or topics for future agendas. I will just say that I've asked for a future agenda at least to have our director report any recommendations and change of policy or procedure on handling incidents like this. I'd just like to know. It's an informational request. And then if you have any information at that time about things we should do that are not in county dog parks, but in municipal dog parks, either in Reno or Sparks, if you could provide us an update on that too. And there may be nothing that we need to change. That's one item. Is there anybody else would like to see an item on the agenda? Nothing specific at this time? Okay, all right. Well, any staff comments at this time? Anything? Nothing? Okay. All right, no staff comments, just the one request. And then, so we'll close out this item, and then we'll open our final public comment. Madam Clerk, is there any final public comment? And she is saying, shaking her head no. So we'll close out final public comment, and I will declare us adjourned. Thank you so much for being here, everyone, and for our board. Great meeting. We got a lot done here today, and very expeditiously. Thank you.